The following is for informational purposes only. For medical advice, please see a medical professional.
Welcome to Staying Alive with Margaret and Susy. In this episode, we're going to talk about advocating for your own health. Susy and I have both been public healthcare workers at different points in our lives. We are both very good at this, but we're aware that not everybody is. And so we think this is an important episode to do. And when we talk about advocating for our health, what we're talking about is being an active participant in our own healthcare decisions. We're talking about understanding and managing what's going on with our health, and including research before we go into the doctor's office and asking questions and getting our tests done. Susy and I are very good at that. We're not going to talk too much about access to healthcare today. Disclosure, we do live in the United States and we have to pay for our health insurance. We have to pay a lot of money for our health care here. And there are a lot of issues. And so we're going to have a whole separate episode on access to health care. And Susy knows somebody who is a specialist in Medicare. She'll be bringing that person in when we start doing more interview style, bringing guests in. And Susy, you want to say something about we're not doctors.
Yeah. The information provided is for informational purposes only. If you need a medical diagnosis or advice, you need to speak with a medical professional.
Yes. So what we're doing today is we're helping you to figure out when should I go to the doctor and what do I need to know before I get there? What should I do to get tests done and get the help I need from my doctor? So we're going to start with annual checkups as a part of healthcare advocacy. And Susy's worked a lot with young children. I've worked with adults only. So Susy, why don't you kick that off?
Yeah, we begin as parents for advocating for health for our children. From the time kids are babies till the time that they're teenagers, you're working to advocate for all sorts of things for their health. I used to work for a Head Start program where my job was to track whether or not people were getting their children in for well child visits and whether or not they were immunized. And I think it's super, super important to make sure that those things are happening. Even though you can look at a kid, you can look at a person and go, well, they look healthy. You don't know. You don't know. So I'm a big believer in making sure that children have an annual checkup, even as they get towards adolescence and teen years. And also, I'm a big proponent of vaccines. I know it's a really controversial topic. Again, there's a lot of people who are anti-vaxxers out there. But I just want to say one thing about vaccines, and that is if you want to be immune to a virus, you need to be exposed. It's kind of a specific immunity. Mm-hmm. You're trying to become immune to a specific virus. The only way to do that is to be exposed to that virus, develop immunity. That's why we need vaccines. And my husband's family, his grandmother and her sister, both came down with a childhood illness. One had whooping cough, one had scarlet fever, and they both went deaf the same winter.
Mm-hmm.
So in our family,
before vaccines.
Oh yeah, this was in the early 1900s.
Now we can
prevent that. We can prevent that, and so in our family, it isn't even a question. Mm-hmm. We don't want to go there.
And it's interesting. Young adults don't often think to get annual checkups because they're young, they're adult, and if they don't feel that they have anything wrong with their health, it's not uncommon for young adults especially, and really it's not uncommon, unfortunately, for many adults to only go to the doctor if they have a specific medical condition going on that they want help from their doctor to diagnose and treat. Mm-hmm. So many people don't get annual checkups. Yeah. And we know that it's so important. And the next thing you know, you've reached older adulthood and you haven't been tracking things that you could have done and you should have done. And one way to consider it is think about your parents and your grandparents and the different illnesses that they may have had as they age. And unfortunately, with some of these things, if they run in your family, chances are they may be running in your body in eventuality. No matter how much good diet or exercise or lifestyle changes, maybe we think, well, my dad smoked cigarettes and I didn't, so I don't have to worry about colon cancer. But you know what? Unfortunately, you do need to still think about that. So when you see your doctor, make sure they have a really good medical history on you so that they will be aware of that. And then, of course, you have to do your research as well. Let's say the average age to begin a colonoscopy is 50.
Yeah, it's
but
50.
You have to tell your doctor, you know what? My dad had colon cancer at 53. I think I'd like to start getting my testing at 40, at 35.
Well, actually, and unfortunately, there's a rise in colon cancer among people, not close to 50, like people in their 30s.
Yeah.
It's a problem. And
your body, your health, you get to advocate for that. You get to say, I want my colonoscopy now. At whatever age. I mean, that's just one example. The other things that you want to test for.
Breast cancer is one of them. If you have a family member that has breast cancer, you even if you don't know whether or not it was genetically related breast cancer, you still, if you have a family member that's had breast cancer, you might want to start mammograms at an earlier age.
Yes.
Or even more serious cancers like ovarian cancer, something like that.
And then testing for other things that lead up to a medical problem that's a precursor, such as high cholesterol. My niece knew that her father had a heart attack in his 40s and was found at that point to have like an extremely high cholesterol. And so she started getting tested for her cholesterol, I think when she was a teenager, if I'm not mistaken.
Yeah, there's sometimes
and it
even
turned
children.
out that ran in her families.
When I was, my daughter was in childcare, there was a little girl who had high cholesterol, and she was a preschooler, but it was a familial thing. It would run in her family. Yeah.
Yes.
So, and there are familial things that run around, and you don't know. These days, you can get genetic testing for things, but it's usually not done unless you already have something, and then they test you for the genetic markers. But primarily, it's not done, and so it is important to know your family history if you can.
Yeah. My mother's family had a strange thing called familial sinus bradycardia, which is a fancy way of saying that the older they got, their heart was beating slower and slower and slower, and they all needed pacemakers. And but then my mom didn't want to tell her doctor about it because she couldn't stand the idea of a box being, cut into her chest and put in there. And by the time she finally admitted it in her mid to late 70s, her doctor said, "Why did you wait so long? Your heart rate's almost down to zero. You got to get this pacemaker in your body." So,
Mom,
we need our regular checkups, and we need to get our blood work done, right?
Yes.
And that's part of what doctors will do. There are all kinds of screenings for all kinds of things which can be just checked with a simple blood test.
Yeah.
And of course, adult onset diabetes is a very rampant one in our culture. And so the doctors want to check your glucose levels. They want to see what your triglycerides are like. A1C, do you want to explain that, Susie?
Yeah, A1C measures how your blood sugar has been doing over the last 3 months. And it's a pretty good test. And the nice thing about it is it'll tell you if you're in the normal range, the pre-diabetic range or diabetic range. And if you're in the diabetic range, of course, you need to talk with your doctor immediately. They'll tell you need to talk with them immediately and start either on medication or a drastic diet change. If you're in the pre-diabetic change, there's a lot of things you can do lifestyle-wise to change what you're eating, how much you're exercising, how much sugar you're eating. So it's a really useful test. Just make sure you don't spend a month beforehand eating things you shouldn't eat.
Oh, yes.
Anyway, but it's a very useful test. Yeah.
So, you want to get your test done. There's certain things that are silent, and some older people can have infections in their body and they don't even know it. They just think, I'm dizzy, my balance is off, but truly they have an infection. And so,
it's easy to attribute things to aging. It is easy to attribute things to aging. Oh, I'm just tired because I'm old. Just think of that as normal. Is it normal? Sure. I mean, there are certain things about aging that are normal. You might need more rest. Your back might hurt a little bit more when you're out gardening, like mine. But I mean, you still have to pay attention. And it's easy to be in denial. Like, I hate to say this, I'm not trying to sound sexist, but many men are in denial. The statistics are showing that about 55% of men don't get regular checkups. Now, I don't know if that's a overall statistic, and it might be, and that is in the United States. But I think it is really true that access to healthcare is it depends on a lot of things. People who are married, I think, do a little bit better because
married men. I mean, isn't there saying that married men live longer?
Because somebody's watching out for them. Somebody's watching out for them and trying to get them into the doctor. But also socioeconomic status has a lot to do with it. Once you get to be a certain age, you get on Medicare. But before that, sometimes people have a really hard time.
Yeah, so sometimes it's not denial, sometimes it's access, financial concerns, and things like that. Sometimes it's fear, sometimes it's machismo. There's so many different reasons. I think in the case of my husband, he's just like a little bit scared of doctors. He's got like that vasoreaction where he faints at the sight of his own blood. Like he will avoid doctors as much as he can, or he used to, until one year he had some type of problem and they didn't know what it was. And I said to him, well, what does your blood test show? And he said, oh, I don't get my blood tests done. Turned out he hadn't had his blood test done in 7 years. So because
he doesn't like needles, right?
Right. And so he goes in for his blood tests, and his white blood cells and red blood cells were so off whack that they actually thought he had some like terminal cancer. And it turned out it was an infection. He was okay. He came through it. But he had gone 7 years without his blood tests and got a lot sicker than he would have if he had been getting those tests done right away.
Well, I think a lot of people have the attitude that, well, it's whatever happens,
So getting the help that you need, if you don't have the ability like Susie and I do to get our tests scheduled for ourselves and maybe our children, there are other ways. My husband's doctor now knows what he's like. And so his doctor has assigned him something called a health navigator. And like, do all places have this? I mean, we have excellent
I don't think we have it.
We have excellent health care where we are. And,
we don't have that here.
He gets a phone call. This is your health navigator. Your doctor has assigned me to you, and it's time for you to And it's, I wish that everybody
they have it at my vet's office. The veterinarian calls and tells me when the dog needs something.
Yeah, why don't they have that? So what are the ways that people get advocacy help? Like,
well, there's a lot of different ways to advocate for your health too. I mean, you advocate for your health by taking care of yourself, by eating right, by exercising, by making sure you get enough sleep, by keeping your stress levels low, by hydrating. But just because you're doing those things doesn't mean you shouldn't get regular checkups. People who are like super healthy, who run all the time and do all the right things, they still need screenings. They still need to go and get regular checkups. And, I want to say, though, if you are going and getting your regular checkups and you don't feel like the physician that you're seeing is listening to you, if you don't feel listened to, try to find somebody else, because it's so important to be listened to.
Yes.
I recently myself switched doctors because I didn't feel like my doctor was listening to me.
Good for you.
And it was not a simple decision for me to make, because it was kind of a hassle. But I think it was a good move for me personally, because I just didn't think the doctor listened to what was going on with me.
And I think, unfortunately, it's part of our society too, where sometimes aging women of color, we're listened to even less.
Yeah.
And so we want a doctor who is listening to us. And I feel so fortunate that I have that, because, like, for instance, when I found the lump in my neck and I was told, oh, well, let's just watch it for a year. I was like, no, something's wrong. I want to be tested right away. Turns out to be cancer, blah, blah, blah. And the oncologist said to me, you saved your own life.
That's
and
great.
Then I went through cancer treatment, and I was recovering very slowly. And they thought, oh, this is just an older woman out of shape. And like, no, something's wrong with my heart. And I mean, I already knew that I had this lifelong mitral valve prolapse, but nobody had thought to check my heart after my cancer treatment. Turned out I was in congestive heart failure and I needed immediate valve replacement. So, like, know your own body and really pick up for yourself. And
I was told to get my gallbladder removed. So I went to a surgeon, and the first surgeon that I saw said, oh, you can live with an enlarged gallbladder. And I'm like, okay. And so I waited a few months, and then I saw a different surgeon, and the doctor still wanted me to get it out. And it was like the difference between night and day. I mean, the second surgeon listened to me, spent lots of time with me, explaining exactly what was going on with my digestive system and why I needed to get it, removed. And the follow-up was wonderful. And so it just really is important to be listened to. And if you don't feel like you're getting the results, then ask for a second opinion. And most insurance companies, Medicare does anyway, a second opinion is covered.
Yeah.
If you don't like what somebody says and you want to think maybe there's another idea out there.
Yeah.
Yeah. It's important.
If you can't do this for yourself, or you have a family member who can't, then just think about finding a family member or a friend who can do it to help the older person in your family, or whomever it is that needs it.
The other example of that is advocating for somebody when they're in the hospital.
Oh, yeah.
It's super important. Like, I really feel for people who go to the hospital and don't have family nearby. So no one's like coming in and following up with the doctors, because when you're ill, it's really hard to remember everything that the doctors say to you. And you just really need an advocate when you're in the hospital.
Yeah.
And if you don't have one, make sure that you have contact with the medical social worker who is in the hospital. They should be contacting you to see what's going on.
Yeah.
Because
and
it can be really scary.
Have more than one, right? Because when I had my heart operation, there was a complication. My husband, who was my advocate, was so scared he couldn't think straight. And my sisters were trying to find out what's going on, and he couldn't. He was just frozen with fear. And my sister said, Margaret, could you please make me one of your healthcare advocates? I want to talk to the doctor. Keith is much too scared to keep track of what's going on. And so I added my sister all the way from California to Florida. I added her as
which means, when you say added, does that just mean so that you allow the doctors to talk to your sister?
Yes.
Yeah.
Added it onto the medical paperwork in your doctor's office.
Yeah, it's important.
Make sure that, in my doctor's office, they make you fill out forms when you turn 65 about for medical power of attorney and
Right.
your health care.
We have medical power of attorney, and I kind of did the same thing. I didn't want my husband to be the one to try to decide if there was something really serious. So I assigned my sister and my daughter somebody because I felt like it's important to have that. Make sure you have somebody. Yeah.
Well, let's talk a little bit about research. I always say no Google doctoring, know your sources. Sometimes somebody will call me because they know I know about healthcare. And they say, "Did you hear da da da?" And it turns out to be Dr. Quackery, on Instagram. It's like, well, no, Susie and I, we go with Mayo Clinic. We go
or
with
Harvard Health,
Cleveland Clinic. We go with Harvard. We go with the NIH.
I also get things from American Dietetic Association. So on a regular basis, I get little newsletters and stuff. And that's really good information because it's really up-to-date nutrition information. I mean, we always have to remember, my friends who are doctors tell me this, you don't get much nutrition education when you're in medical school.
Yeah.
It's very, very limited.
Right.
And so many doctors, though, spend the time to research and find out more about nutrition as things go on. But always remember that if you are looking for nutrition information, the American Dietetic Association is really good. I always recommend to people not to get their medical information from someone who's trying to sell something.
Good point.
Yeah. I mean, if they're trying to sell you a vitamin or a supplement of any kind. I've even myself been guilty of clicking on something about, some kind of health information, and they want to sell you a program or a video or something like that. And I'm like, no, thank you. But it's really important to get your information from a reliable source.
Yeah.
Be very careful.
And get a second opinion if you want. Unfortunately, I know my doctors and I know who I can trust. But if you're going to see a doctor for the first time, I know some people feel like, well, of course the surgeon's going to tell me to get surgery. He's a surgeon. He wants to cut
they want
me
to
open,
cut.
And
I think they have plenty of time cutting. I don't think they're looking for people to cut.
Right. I mean, Susie and I know that's not something to worry about with the doctors that we would choose. But go ahead and ask your doctor for all the information you need. When I was recovering from my cancer, and never say never. Like I used to have the attitude, if I ever get cancer, I'll let them cut the cancer out, but I'll never get radiation treatment. And then when it came to it, and they said, we think you should get radiation treatment, I asked the question of the doctor that I trusted, show me the research that shows what are the chances my cancer will return if I don't get the radiation versus if I do. And she showed me the research, and if I didn't get the radiation, there was a 50-50 chance the cancer would return. If I did get the radiation, less than 5% chance. And I said, let's get the radiation.
Yeah. So, I knew a lot of people, I had cancer as well. And people say, oh, just, don't do radiation, just eat this and this and this. Well, my oncologist and my breast cancer surgeon both honor, working with a naturopath as part of your treatment. But the naturopath would never, on my experience, would never tell you not to get treatment. Any good naturopath.
Right.
But the oncologist told me she works with naturopaths all the time. And so to go along with what you're doing, there's some really good resources out there. And there are dietary changes that you might need to research while you're going through some kind of treatment, whether it be cancer or arthritis or heart disease. But yeah, cancer is serious business. And I think it's a perfect example of the blend of Eastern and Western medicine.
Mm-hmm.
I mean, some people are lucky enough to live in communities where they have integrated medicine. Unfortunately, I don't have that in my community, but I wish I did. I mean, we have separate practitioners. There's naturopaths, chiropractors, acupuncturists, doctors, but there's not a practice where they're all in one practice.
Yeah.
Yeah.
So once you've understood your conditions and you've had your treatment and you're getting taken care of, it's important also to keep really good medical records and keep track of when you need your follow-up appointments.
Yeah.
I mean, as we age, we're tracking so many systems in in our bodies. I'm getting my eyes checked once a year. I'm getting my colonoscopy every 5 years. I'm getting my checkup, that checkup.
The dentist, right.
And so it's important to keep a calendar somehow with your follow-up appointments and when to schedule. And
unfortunately, doctors aren't like veterinarians. They don't tell you when you need your shots and your checkups.
No.
And I wish that there was a little bit more of that, but there isn't really.
Well, as more technology is through the computer, there are like my medical system does have something called My Chart.
Yes, we have that too. Yeah.
And if you look into it, you can find out but it takes a bit of digging, and it takes having a computer. It takes being able to use the computer. And there we are back to access and issues that not everybody has. So
and
nothing
I
wrong
know
with
that,
the paper.
That's right.
Paper.
I mean, my husband hates the computer, and, I think about people like him, he's in his 70s, who don't really want to get on the computer, and they don't want to access things that way. So it is really important to keep good records so that you know when you need to go in and what tests you're going to need. And I always ask for, now it's on my chart, but before that, I would always ask them to mail me a copy of my blood work, because this was before the computer thing. So if you don't have a computer access and you don't want to track your medical on the computer, if you go to the doctor and get a blood test, it's perfectly within your rights to ask them to mail you a copy.
Yeah.
And so that you have one, because I think it can be very helpful.
Yeah. And just keep a file at home somewhere.
Yeah.
Well, I think we've covered it pretty well, what we wanted to
I think so
do
too.
today.
I think it's important that people advocate for themselves when they're sick and when they're not.
Yes. Our bodies, ourselves is what
let's take care of it. Yeah. And take care of those that you love too.
Well, I think that's it for today.
Yes.
So thanks for being here with us. And until next time, we are
staying alive.
You've been listening to Staying Alive with Margaret and Susy. This show is hosted by Margaret Cooley and Susy Hymas. To subscribe to our show, leave a comment or ask a question, please visit stayingalivewithmargaretandsusy.com. Our podcast is available on all major podcast platforms. If you've enjoyed our program, please feel free to leave us a 5-star review. Thanks for listening.